to try to, because we are over time, so I'm going to do this very quickly and come up with some top line headlines for each country. So I'm doing 3 countries. In Bosnia and Herzegovina, it's obvious that we need massive influx of funding into the country, because services for MSM and harm reduction services in particular are massively unsustainable. There's also massive stigma for men who have sex with men, and so the services for men who have sex with men are just not adapted to serve people there. And of course, HIV infections among MSM have tripled in recent years in Bosnia and Herzegovina. So there's a real necessity to invest in working on these populations. One thing that also came out of Bosnia and Herzegovina was that there isn't a strong civil society on TB there, which is really problematic because it's seen predominantly as a clinical condition and without any social aspects. So that's obviously something that needs to be worked on. On Georgia, I was very impressed with Georgia. In the COVID response, I was impressed by the leadership. Clinical hotels were very interesting to me, how there were in the initial stages doctors and nurses within hotels. These were quarantine hotels for patients, for people traveling into the country, and services were provided there. Of course, you've heard from Nino about the impressive TB innovations that have been instituted to recover the reduced detection rate in TB. So that's been really impressive. Something that also stood out for me was at time of writing, and this may have increased since time of writing, is that 5 people living with HIV died of COVID-19 complications. And after that, what happened was they expanded the work of the mobile brigade, and they provided PLHIV with medicines at home and introduced online consultation. So that was very interesting. Another interesting thing from Georgia was that the price of street drugs increased 3-fold. And, that's a horrible financial burden on people who use drugs. In addition to that, many ex-prisoners in Georgia worked as construction workers. And during COVID, of course, they lost these jobs. And when people lose their jobs and have to struggle to even find food, they're not going to focus on whether it's HIV or TB treatment. So, these are massive. Financial situation is obviously a massive deterrent to people sticking to treatment. And just final reflections from Moldova is, of course, you heard that there was a 6-month supply of ARVs, and there were walking outreach services and mobile units used to deliver ARVs to remote regions. There was a concern because there were stockouts, and I see Dr. Iurie is on the call today, so maybe he can answer better and describe this in question and answer later. But there was a switch over from methadone to methadone from buprenorphine due to stockouts. We also learned that in Moldova, active case finding via mobile X-ray screening has stopped. And it was also good that the Ministry of Health issued a decree to empower the NGOs in TB detection, which you, of course, heard Lilian talk about. So those are my highlights of what I took from the research, and would be keen to hear from Dr. Iurie. You're on about the stockouts in particular. Nice to meet you.
As I understood, I needed to present something, correct?
No,
you mentioned that.
Yeah, if you could just maybe two lines on the stockouts.
Sure. It's not that we have drugs for 6 months. We issue the drugs for 6 months. This happened before COVID as well, because my colleagues from other countries with lots of people are traveling to other countries for work, so we issue them larger stocks. In the cases of labor migrants traveling to other countries to work, we could issue them 6 months stock. And because of COVID, we used this practice a lot so that people didn't have to travel to the treatment center and collect their drugs. And this helped in the COVID times a lot. As to methadone, it so happened that the next procurement had to come from Italy and it was taking too long. So as a result, we had to reorient ourselves. And we did fast procurement at the national level, not through the international platforms, because methadone is being procured by the state for 3 years now. And we found our own opportunities to procure that urgently, procure methadone urgently, to make sure the substitution therapy goes uninterrupted. Before COVID, there were only some individuals getting the drug for 3 to 5 days. And in the conditions of COVID, this was basically a forced measure. And almost all of the patients were receiving the drug for 5 to 6 days, sometimes even for 7 days. So under these conditions, we managed to resolve these problems. And basically, it's similar to what the colleagues were saying. Mobile clinics were taking the drugs around during the lockdown. Syringe replacement program, substitution programs, outreach workers have joined in the effort. And basically, we managed to avoid the interruptions in drug supply, in methadone issuance, and substitution therapy and harm reduction programs. And basically, we didn't have so much shortage. It might sound odd, but it wasn't so bad. And infectionists could reorient themselves to COVID centers. And in one center, a nurse had to issue the drugs as an exception again, because a doctor was sick with COVID and another one was working at COVID center. But this was the situation and it got handled. There was also a problem with medical staff, not only with our beneficiaries, but still it worked out. And all these measures could be resolved by phone, through online consultations, etc. We have kind of found our way around this situation because COVID is new for everyone, not just for us. So we have been searching for ways to handle this. We were trying to send drugs abroad, to send medicines to them, tried to find ways to provide drugs to medicines for patients who got stuck abroad, to make sure that their treatment goes uninterrupted in the COVID times. I cannot say this is a great thing, of course, because the lockdown is over and now now Moldova doesn't have a problem with movement around the country. You can take a train, a car, whatever you like. It's a problem to travel outside Moldova, but not within Moldova. And it turns out that the patients started calling us and saying, you know, we really liked it that you are taking the drugs to us, to our village, for example, closer to us. We would like this to be something done on a regular basis. And again, clearly, it's not a great thing for us doctors. One thing is extreme conditions, and another thing is that, you know, we need to take a viral load test. We need to ask the patients about their state of health. So there's a bit of negativity there, but still, people understand the problems.
Thank you.
And this drug delivery was, at that time, was a great practice, but now when they're waiting for us to bring the medicines to them, it may not be so great. Our distances are not big. In some countries, you need to travel 200, 300 kilometers to treatment center, but we are a small country and it's not a problem to travel. And the centers are distributed around the country. 30, 50 kilometers, it's not a problem to travel once every 6 months. That's the brief overview. If you have any questions, I'll be happy to answer. This is what we did in Moldova to make sure that COVID doesn't impact our HIV patients so much. Unfortunately, we don't take the statistics as to the number of HIV patients who had COVID. Only if they tell us during the standard examination, regular examination, that it had COVID, then we know. We know of 4 cases of co-infection of HIV, TB, and COVID, and they died. And 1 patient with TB and COVID who died, and she was a fresh, a new case. I don't have any other official figures. If you have questions, I'll be happy to answer them.
Thank you so much, Doctor, for your reflections and for your ad hoc comments. And apologies for putting you on the spot that way, but thank you so much. Let's go to Pavel Akhtanov. Pavel, who has been my partner in crime through this work. Pavel, if you have some top-line reflections about Russia and Kyrgyzstan, it will be much appreciated.